Low Carb Canberra, welcome to the next part of the conference, and thank you very much to Tara Whelan, Tracy Kimberley, Vashti Bufanti, Rebecca Joseph, and Ash Kimberley for sharing about their experiences doing the type 1 journey. And a couple of things that I've got from it is this notion of be well informed, and that's something which is a theme throughout this conference. For those people undertaking a low carb journey, be well informed, take responsibility, get support, find the people out there who will support you. Now we're going to move on to the rest of the day, and before I do, I would just like to share a little something with you. Actually, for me, this is a big something. Now, I hope that this is on. So, guys, is this coming up on the?
Yeah, I can share that.
Yeah. So, some months ago, I wrote an article. I co-authored an article on reversing type 2 diabetes. A GP guide to reversing type 2 diabetes, and submitted it to Australian Doctor. Australian Doctor is a magazine that goes out to doctors all over Australia. My co-author is Dr. Ron Schweitzer. He's a GP and medical educator practicing in Melbourne. And the article was published just a few days ago. I actually only found out about this late last night. And the key messages that we're getting out there are that type 2 diabetes can be reversed through dietary carbohydrate restriction, and that even very metabolically unwell obese individuals with long-standing type 2 can have significant improvements in glycaemic control, blood sugar control. We quote the American Diabetes Association consensus statement, which notes that low carbohydrate eating patterns have the most evidence for lowering blood glucose and thus decreasing the requirement for blood glucose lowering medications. And also, our key point is that GPs need to know how to support people who wish to use dietary carbohydrate restriction as part of their approach, because we know that there are people going to doctors and the doctor doesn't know and can be unhelpful. Doctors need to know how to safely deprescribe insulin and oral hypoglycaemic medication. Okay, so I just needed to say yay, that's out there in GP land. Unfortunately, this article is not available to the general public because you need an Australian Doctor login to access it, but it's available there for GPs. Now we're going to move on to the rest of the day. The next big session is called Health, the Big Picture, and there is diverse presentations. The first presentation is from Sam Johnson, who's a regenerative farmer, and he's going to talk about where food comes from. So there's a bit of a theme happening here, where food comes from. Then we're going to have a presentation from Charlie Bloomer about how food gets to us, so real food miles. And then we have Matthew Ryan and Patrick Ryan from Symmetry Dental talking about what happens when the food gets to your mouth, chewing and breathing. After that, we have a panel session on family-friendly low carb. Around lunchtime, we will have the session on neuromitoketo, so brain health and low carbohydrate approaches. And then at 3 o'clock, we have our guest speaker, Dr. Pran Yoganathan, coming in from Sydney. And after that, our final panel on creating change.